Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune, and today I'm going to tell you everything that you need to know about the ionized calcium or the serum ionic calcium level. Now, this is a type of a calcium test, and if you're watching this video or you've been told to get this test done, the first thing that probably came to your mind and you're very confused is how is this different from the normal serum calcium level or the calcium blood test which you probably have already had. So that's a great question, and before we go ahead, I want to tell you the difference between these two because that's the reason why you're probably here and watching this video. So the calcium blood test or the serum calcium test is a test which measures the total level of calcium in your blood. Now you may not be knowing that every single chemical, hormone, transmitter in your blood is usually present bound to something. It doesn't just float around freely in your blood. Most of these things are usually bound to a protein or some kind of a complex in your blood. A very tiny fraction of that substance is usually available freely in the blood. This is true whether you're talking about something like the thyroid hormone or you're talking about testosterone or even the calcium. A very tiny fraction of the calcium in your blood is actually freely present inside the blood and can directly take its actions. The rest of it is actually bound either to a protein or to some kind of a complex. I don't want to confuse you about how these things are bound. It's not important. What you need to know is that even the calcium is not completely free in the blood. In fact, a very tiny portion of it is actually free, and this is the part that is actually active and that is actually doing all the work of calcium in your body. So when you measured the calcium level in your blood, when you had that calcium test in the past, which was called the serum calcium test or the total calcium level, what you were measuring was the complete calcium level in your blood. This included everything that was bound as well as the part that wasn't completely bound. But now, even if you measured the total calcium level, this is the calcium that is not bound to the proteins or that is not complexed with something. This is only that little tiny fraction of the calcium that is actually active, and that's why this is a completely different test. The total calcium test does not tell us how much of the calcium is bound and how much is free. We just know the total amount. But what if the amount that was free, the amount that is actually acting, is too low? It could be that the total calcium was normal, but the free calcium or the active calcium was too little. That's where this test comes in. It's called the ionized or the ionic calcium because that part of the calcium exists as an ion. It's not bound, it's not neutral, it's a live ion, and it actually takes all the actions of the calcium in your blood. That's why this test is important. Some of the reasons why you may have been referred to get this test done is because your total calcium result was borderline or confusing and your doctor wants more clarity. This test is also commonly advised in ICU, surgical and critical care settings where patients who are in critical condition, we really need to know everything about them, how their bodies are doing, and that's why this is advised in those settings. Thirdly, you might have a kidney condition, a liver disease, or abnormal protein levels which are making your doctor wonder whether the calcium being bound to these proteins is not being utilized correctly. Lastly, you could have something called a disease of the parathyroid gland. Parathyroids are glands which are present near your thyroid, and their entire work is to manage the calcium level in your blood. And if something's wrong with your parathyroid level, it might mean that your ionic calcium levels are off, and that is something that is a cause of concern because this can affect varied functions in your body. So these are some of the reasons why your doctors may have asked you to get this test done. In this video, I'm going to tell you what this test means, who should do this test, some symptoms that you may be having that suggest that you should get this test done, what are the normal levels of this test, and what do abnormal levels mean. So stick around with me to the end of the video and I'm sure that you will benefit and you will learn something. And if you have any questions, make sure to add them in the comments and I'll do my best to answer them as soon as possible. Thank you. If you have symptoms like twitching of the muscles, tingling on your hands or fluttering of your heart, you should consider getting an ionized calcium blood test done, and I'm going to tell you everything that you need to know about this test. So what is ionized or ionic calcium and why is it different from calcium that we normally talk about? What you need to know is that calcium in your body is generally present in two places, in your bones, which is what makes them so hard, and also to some extent in your blood. The thing is that the calcium that's present in your blood is not exactly free. Now, what do I mean by free? Calcium in the blood, like several other substances, is actually bound to certain proteins. It's not present purely as calcium, but rather as a complex with other proteins. And as a result of being complexed, it's not available for direct use. The body needs calcium, yes, but that calcium should be available in its original form and not joined together with something else. So, what actually happens is that a very small quantity of the total calcium in your blood is in fact free, ionized or ionic calcium. It carries a charge, and that's why we call it ionized calcium. This small tiny fraction of the total calcium is what we call ionized or free or active calcium. This is the calcium that actually does the job, that actually does its work, because it's not complexed with any proteins. And it has various roles, including the maintenance of your heart rhythm, conduction of impulses through your nerves, during the contraction of your muscles, and so on. It's this component which is free that actually causes the effects of calcium to be seen. And that's why when we measure the calcium level in your blood in the routine calcium blood test, what we measure is the total calcium. We do not really measure what component of that is freely available. That is why we need a separate blood test that will only measure the freely available calcium in the blood, which is a very small component of the total calcium. That's the difference between these two tests, and today we are talking about the ionized or free calcium level in the blood. When do doctors advise the ionized calcium level? In which conditions? The most common condition is in patients who are critically ill, because in these people, even small derangements of these levels can be lethal. Number 2 is in people who have abnormal calcium values. If your total calcium level, which was done on your routine calcium blood test itself, was abnormal, your doctor may want to check whether the ionized or the free calcium level is also significantly deranged. And that's one of the situations. So let's say you went in for a routine calcium blood test, that value came back as abnormally high or low. Your doctor now wants to know, all right, the total calcium level is abnormal, but what about the free calcium? And that's when they will advise this test. And the third situation is in kidney diseases, because the kidney is the main organ that is responsible for holding the calcium in your blood. It regulates how much calcium is kept in your blood and how much is lost in the urine. And that's why people with kidney diseases may have derangements in their calcium levels and consequently in their ionized calcium levels. And so people with chronic kidney diseases, diabetics, people with very high blood pressure, people with autoimmune systemic diseases like lupus may require an ionized calcium level test to check whether the kidneys are significantly affected or not. So what are some of the symptoms that you might experience which could indicate that you should get this ionized calcium level test done? Well, muscle cramps, numbness, tingling, feeling a flutter in your chest, feeling very tired all the time, vertigo or giddiness. These are all very non-specific symptoms that could indicate there's something wrong with the balance of calcium in your blood. Falling down and having fractures very easily just generally would mean that there's a low level of total calcium in your blood as well. So how is this test done? Well, it's a simple blood test. Around 2 to 3 ml of blood will be drawn into the vein, from the vein of your arm into a tube, and it will be processed in the lab. The test does not require you to be preparing in any special way. You don't need to be fasting. You don't need to change the medications that you're having. There's no special preparation. You don't have to provide the sample at any fixed time of the day or night. Provide the blood sample at any time. It's a routine blood test. The test will be processed by the lab using an automated analyzer, and the result will be provided to you probably on the same day itself.